Welcome, everybody. Welcome to Manhattan Psychology Group's ABA CEU webinar series. Thank you so much for joining us. My name is Andrew Ng, and I am the Professional Development Coordinator and BCBA here at Manhattan Psychology Group. And I'm excited to kick off today's webinar. There are a few housekeeping rules to keep in mind before we get started. So firstly, we will post the codes needed in order for you to get your CEUs on the screen, and we will verbally say them. Please make sure that you are collecting both CEU code words and complete the survey, which will be shared at the end of the webinar in order to receive your CEU certificate. You will need to stay for the entire webinar in order to get credit. And you can find a link to the slides for today's webinar by clicking the chat button. And webinar recordings will also be available. Okay, we can go on to the next slide. So today's webinar is titled Being a Compassionate Supervisor, presented by Lakin Crone. And right before we begin today's webinar, I would like to tell you all a little bit about Manhattan Psychology Group. Since 2011, our team of 200+ psychologists, behavior analysts, and educators provide wraparound care services, including psychological testing, applied behavior analysis, and educational services. We also offer CBT, social skills groups, neuropsych testing, tutoring, parent training, and more. We also offer virtual and in-person services for all ages and conditions, and we serve the greater NYC metro area across all 5 boroughs, Northern New Jersey, Long Island, and Westchester. We also accept private pay, commercial insurance for ABA, and DOE-funded services. Our vision at MPG is to create a future where individuals and our families feel supported, connected, and empowered. And our mission is to provide multidisciplinary integrated support for individuals and their families who experience mental health, behavioral, and educational challenges. So please welcome our presenter for today, Lakin Crone. Lakin is our recruitment and engagement specialist for Manhattan Psychology Group, where she works closely with the team members to align with the organization's core values. With 9 years of experience in the field, she's a board-certified behavior analyst and licensed behavior analyst. Her experience spans across clinical, home, residential, community, school, and telehealth settings as an RBT, BCBA, and assistant director. Lakin received her undergraduate degree in psychology and her master's degree in foundations of behavior analysis. She has a passion for building relationships with other professionals and helping them pursue and achieve their goals. We are so excited to have Lakin here today to share her expertise with us.
Awesome. Thank you, Andrew. I am excited to be here. Any of you that have joined our webinar series before have definitely seen me on the back end of things, helping out with the Q&A, posting links, and also reviewing open jobs, which we will be doing after this. So if you're interested, join us. But I'm excited to be the speaker today and talk about a topic that's near and dear to my heart, which is providing compassionate supervision. I know compassion is a big buzzword within our field right now, but I think it's something that a lot of us have been doing for a long time. We may not have just classified it as that. And then those of you that have been part of our webinar series have also noticed that we usually have the chat off. However, I feel very strongly that supervision is a collaborative process between supervisees and supervisors. And so throughout today's talk, I'd love to get everybody's insights and their own experiences to share with those of us who may be new to the field or who have been here for a while and are just looking for additional ways to provide compassionate supervision. All right, today's objectives, we are going to work to identify traits of compassion, empathy, and active listening in supervision. We are going to identify opportunities to increase engagement with our supervisees, and we will utilize existing tools to complete a self-assessment of supervision skills. All right. So before we get started, since it is a BACBU, I think it's important that we reference the parts of our ethical code that we should be utilizing a lot in our supervisory practices. This is only a brief portion, but they cover a lot of things that I think are very important. So starting with our core principle of treating others with compassion, dignity, and respect. Then we have 4.01, compliance with supervision requirements. I think one of the basic skills as we become supervisors within our field is that we remain knowledgeable. The BACB has put out a few newsletters recently that have outlined some upcoming changes to supervision requirements. So I kind of wanted to touch base just on our current requirements and the importance behind them. And then performance monitoring and feedback, that behavior analysts will engage in and document ongoing evidence-based data collection performance monitoring for supervisors and trainees. I'm not going to read the whole thing for you all. You can all read it too, and you should be familiar with it. But as we move forward and we talk about different tools that I use as a supervisor, I think it's important that we share this with everybody and with our supervisees, the importance to provide and accept feedback. All right, and then we have evaluating the effects of supervision and training. So we are continuously evaluating our own supervisory practices using feedback from others and client and supervisor training outcomes. I know as I got started in the field, this wasn't something I was always encouraged to do, but it's something that you've learned over time that you need to seek out feedback from your supervisees and accept that feedback and learn from it. Some of it's not always going to be exactly what you're looking for, but I think that's important that as behavior analysts, we are demonstrating that skill to accept it and learn from it and move forward with it. All right, and then the current requirements for supervision. You must hold an active BCBA certification. You must have completed your 8-hour supervision training, meet your ongoing supervision CEU requirement. And then this has also been something that's recently been established that if the supervisor is within their first year as a BCBA, they must have a qualified consulting supervisor to provide guidance. So the consulting supervisor must be an active BCBA for at least 5 years, meets their ongoing supervision requirements, and has established a history of providing high quality supervision. And kind of as we get going, I'll have a few polls to kind of see where everybody's at with their supervision practices and where they're at as a BCBA. So as I began doing the research for the CEU and gathering information, I found that there's a lot of articles surrounding the same concerning topic. And it kind of goes with this quote by Sellers and colleagues. Many behavior analysts may have never received explicit instruction or guidance on how to be an effective supervisor or on the critical nature the role of supervisor plays in shaping the professionals in our field, which I think is very relevant. I was recently at WEBA and a lot of the supervision topics talked about this, that as a field, we need to be doing better for our supervisees and we need to be training them on everything, not just their field work. We need to take time to teach them the soft skills and compassion and empathy with the families that we're serving. But I believe that that starts with us as supervisors, making sure that we are treating our supervisees with compassion and empathy, because it's hard. Anybody who's a BCBA now knows the hoops that you have to jump through to get this credential. And it's not an easy process, and it shouldn't be. It's a very esteemed credential. So kind of going back to it, a lack of information quality supervision is being provided to our supervisees. And when we know better, we do better, right? So I found that, like, as I've been reviewing these articles, that I've been providing supervision for 4 years, but I found that I also have room to grow. I just read an article the other day by Dr. Sellers and was like, oh, wow, that is some great feedback, and needed to start incorporating into my practice. None of us are perfect. None of us will ever be. However, we can do better as we know better. And I think it's important to show that humility to our supervisees as we get started in providing supervision as well. And there, just so everybody knows, there will be a copy of the resources at the end of the slide that you can access as well. All right. So let me get my first poll. All right, so this is just going over how many BCBAs are currently certified, which is up to 62,856. which is crazy. That's an insane amount of BCBAs, which is great. So I kind of am just curious, as a BCBA, if you're here, do you currently provide supervision to somebody else who is pursuing their BCBA credential? Oh, thank you guys for your participation. Almost everybody's completed the poll. I'll give it a few more seconds. Okay, I see in the chat that some people are going to start providing supervision. Some people are already providing supervision, a few supervisees. All right. And just to make a note again, polls are not required to gain your CEU certificates today. They're just to gain some information and allow for a more collaborative webinar. So I'm going to share the results with you. About 50-50, 45% are currently providing supervision and 55% are not. Awesome. And then everybody's saying that they want to hope to provide these. RBTs are supervising their BCBAs, not currently practicing providing supervision. So fantastic. At this point, we're considering supervision as supervising somebody who's pursuing their BCBA credential. We'll get on to providing supervision to technicians later on. Right. All right. And then just for fun, I wanted to kind of look at the number of BCABAs, which I know that with insurance requirements, a lot of BCABAs are pursuing their BCBAs now in order to bill services. I just thought this was an interesting statistic because it's actually gone down by 200 people in the last few years, and is not a highly prevalent credential as much anymore. All right. Now, I'm curious if anybody provides supervision to somebody pursuing their BCABA credential or currently holds their BCABA credential. Right. Awesome. So yeah, we have about 10% of our current attendees that are providing supervision to somebody who is pursuing their BCABA credential or currently holds a BCABA credential. Awesome. All right. And then my next one. Oh, hold on, let me go back. For RBTs, so I did not put this slide in. However, if you can toss it in the chat, how many of you were in the field or practicing an ABA therapist before the RBT credential was created in 2014? Yeah, there's a lot of us. I think that's so crazy that in 2014, there was 328 people, and we are now well over 142,000 RBTs in the world or in the United States. Awesome. Yeah, I know. It's so crazy. You look up this data and you think when you started in the field, there was not very many of us, but yeah, 142,000 now. So my next, let me see. Stop sharing. All right, so my next slide is, do you currently provide supervision to somebody who holds an RBT credential? 1999, that's so incredible. '97, 2013, 2009. I was also in 2013 when I got started, so right before the cutoff of getting your RBT. 96. All right, has anybody been longer than 96? 95? So cool. Well, thank you guys all for joining and providing the supervision to our RBTs. Since 93 as a therapist. Very cool. 1970, 1987. Oh my gosh, that's so incredible. Very cool. All right. So 57% of us said that we are providing supervision to somebody who holds an RBT credential. Take a step back and think that you are one of the BCBAs who is supervising one of 142,000 RBTs. And just I like to take this time to think about the work that we're doing for these RBTs. Are we encouraging them to stay within the field? Are these RBTs becoming BCABAs or BCBAs? Are they staying in the field? Are they continuing to provide supervision? As a supervisor, do you feel like you have provided them quality supervision and compassionate supervision to want to stay in the field? Awesome. Okay, let me get my poll out of the way. Right. All right, the next one. How long have you been providing supervision in any aspect? So either to RBTs, to BCABAs, to those pursuing their credential, any form of supervision. All right, I'm gonna leave it a couple more seconds. All right. So 27% have been providing supervision for 1 year or less. 45% were 2 to 5 years. 15% have been in for 6 to 9 years, and only 13% have been providing supervision for more than 10 years, which is very cool. I'm happy to see that we kind of have a wide variety. I think that's going to make for a very interactive webinar, talking about our experiences and how we've handled certain interactions. All right. Okay, so in Bailey and Birch's 25 essential skills and strategies for the professional behavior analyst, expert tips for maximizing consulting effectiveness, there's a quote in there that says, be the supervisor you always wanted, but never had. If you guys don't have this book, I highly recommend, if you're providing supervision to those pursuing their BCBA credential, I definitely recommend utilizing it in your supervisor sessions. It provides a lot of insight to the various skills that we don't have, but this one quote I think speaks a lot. A lot of us have had great supervisors. I've had a lot of fantastic supervisors who have provided me a lot of skills, but I've also had supervisors who didn't push me to be better, or maybe didn't respond as empathetically as I hoped they would, which can also come back on me as a supervisee for not expressing or advocating for myself. Right now, as a supervisor, I tell all of my supervisees that if they can gain one skill at all during supervision with me, it's that they're able to advocate for themselves, because I firmly believe if you cannot advocate for yourself as a supervisee or as a supervisor, you may have trouble advocating for your clients. So I definitely recommend this 25 essential skills. It talks about advocating. It talks about leadership, leading meetings, interacting with your supervisees and parents, and all these other wonderful skills that you need to be a behavior analyst. All right. So then my next poll question is related to our objectives. How important is it to you to prioritize the following items in your supervision sessions? Compassion, empathy, and active listening. And then during your fieldwork hours, were you provided training on compassion, empathy, or active listening? Yes, somebody popped up in the chat that you were shown how you did not want to supervise. I think that goes directly back to that other quote with Dr. Sellers with Bailey and Birch, that be the supervisor you always wanted, but you didn't have. Sometimes you learn from what you didn't get. I love that. I wasn't provided training, but my supervisors modeled the behavior when supervising me. That's part of our field too, is usually, we're going to talk about it later on, and is using behavior skills training in our supervision sessions. And we should be modeling that behavior. We should be a good role model for these. We shouldn't just be able to talk about it. We should be able to demonstrate it as well. All right, I'm giving you guys a couple more seconds before I share the results. A lot of people are saying that they learn compassion and active listening in their psychology courses, in their counseling courses as MSWs, which is very consistent with what I've heard in other webinars and other research. All right. And I see there was somebody who commented, I'm trying really hard to be the supervisor I wish I had. Aren't we all? Shouldn't we all be? If you're not actively trying to do better, what are we doing? And are we continuing to progress the field if we're not trying to be better supervisors than what we had? All right. So here are our results. How important is it to you to prioritize the following items in your supervision sessions? 89% of people said it was very important, and 11% said it was kind of important. I personally would go on the very important side. I think that if we don't provide compassion and empathy and active listening, we may not get as much engagement with our supervisees, and with that can come less buy-in for the clients that we're serving, and the quality of services could potentially decrease depending on that relationship. In the long run, we could also say that by not demonstrating those skills towards our supervisees, they might not want to stay in the field. If they have a harsh supervisor who is constantly yelling at them or giving them feedback in front of an entire group of people, they might have a feeling that that's the only way that ABA works, that that's the only type of supervisor that is present. And I know I don't receive feedback like that. That is not how I want to receive feedback. I want my feedback to be presented to me in a constructive way. And I think through that, it should be compassionate and understanding. Maybe they're having a rough day. Maybe they're usually really great with this client, but today they're having a rough day. What's going on? Maybe I need to talk to them, check in with them. Part of being a BCBA is being able to build rapport with our supervisees. And I think with that comes the compassion, the empathy, and the active listening. Yeah, Lydia, my RBTs have told me, thank you for caring. It's crazy that that's something that's exciting for us. I think it's something that we shouldn't have to hear. They shouldn't have to thank us for caring for them. We should care for them. They are truly, and I talk about this later, that RBTs are the backbone of our field, and we're building the next generation of behavior analysts. And that starts with us as their supervisors. All right. And then, were you provided training on compassion, empathy, or active listening during your fieldwork hours? 72% no, 28% said yes. And a lot of the 28%, I'm guessing, were the ones who commented in the chat that they were in master's social work programs or psychology. However, if you weren't, great. I'm so happy that during your fieldwork hours, you were taught those skills. I think that some of us are taught them indirectly, and maybe not to the way that we should be. Maybe it's lacking in some portions. Maybe they are sometimes compassionate, and maybe sometimes they're empathetic, but not all the time. So just something to keep in mind as we move forward throughout the webinar series and talk about compassion and empathy and active listening. I encourage you to kind of take your biases aside and be open to the idea of providing supervision with empathy and compassion and engaging in active listening. All right. Stop sharing this one. And thank you guys all for interacting. I really appreciate that. Okay, so we're going to get started into what is empathy. The Merriam-Webster definition is: empathy is the action of understanding, being aware of, being sensitive to, and vicariously experiencing the feelings, thoughts, and experience of another. In our field, a lot of us as BCBAs have already been RBTs or have been pursuing our fieldwork. So it should be easy to provide empathy in the way that we interact with our supervisees because we've already experienced that. We don't have to just try and experience it or understand that we've done it. So we're going to go through a couple of examples and non-examples of empathy. And as you read through the non-examples or the incorrect answers, think back and think, did you have a supervisor who maybe responded similar to that? Did you have somebody who you saw get responded to like that? And think of ways that maybe you would respond differently. When you read this example, maybe my answer isn't how you would show them empathy. Throw that in the chat. Maybe other people can learn from you how to be empathetic towards their supervisees. All right, so you have a new ABA therapist who is starting their first session with the client. They told you they're feeling nervous and that they don't want to fail their client. I know that I've had a bunch of RBTs who are like, I don't know if I can do this. I'm so nervous. I've never been in the field of ABA before. I don't know what I'm doing. I don't know what this program is. What do I do? What happens if I fail this client? And so then here are some of the options. Tell them that as long as they read the program thoroughly, they should not fail. It's written very detailed. Tell them that they have an ethical responsibility to provide quality ABA services, and failing is not an option. Tell them about your first session or a relevant time that you felt scared and how you learned from it. Tell them you'll do the session for them and they can go home. All right, I'm just going to give it a couple more seconds. All right. So yeah, tell them about your first session. We've all done a first session with our clients. Either maybe you weren't working as an RBT or an ABA therapist. Maybe your first session was as a BCBA. Maybe you got your fieldwork hours in a school environment. Either way, in whatever you're doing, you had a first time. And it's nerve-wracking. This is my first time doing a CEU. I was terrified. But Andrew showed me empathy and was like, it's going to be okay. You're going to work through it. Same way we treat our ABA therapists and our RBTs. Tell them about their first time. Tell them how they're going to do great and that you're there to support them. And you're not there to just say, you read the program. I wrote it right. I've had supervisors who've told me that. I wrote the program right. You just need to read it. But does that mean that it was written in a way that I understood it? Or maybe I needed clarification on something. That alone would make me feel like I might fail as an ABA therapist. Same thing with telling them they have an ethical responsibility to provide quality ABA. To me, well, they do because they are maybe an RBT. Maybe they do have the ethical responsibility. However, it's your responsibility as their BCBA to ensure that they feel competent, that they are working within their scope of competence, and that they don't feel like they're going to fail, because a fear of failure is just going to increase their anxiety towards session and not want to proceed. All right, let me stop sharing. Samantha shared a really good piece in our chat that I want to share with you guys. This is my biggest piece of advice in the field. Never forget your time as a technician, which I completely agree. I think that you need to remember the hard days, the long days of providing ABA services and working through the challenging behaviors and maybe not having as much support as you wanted. From what I'm gathering in our chat is that not a lot of people had the support that they were looking for when they first got started in the field. So remember that time. Remember that while it may take you an extra 15 minutes to really go through a program with somebody, it's going to support them in the long run. Maybe they're going to think of you as the supervisor who encouraged them to stay within the field and encourage them to pursue their passions. All right, and then a non-example. Your supervisee is expressing how difficult it is for her to work a full-time job, accrue fieldwork hours, finish graduate school, and maintain a social life. How many of us have been there? Full-time job, accruing your fieldwork hours, everything else. So here are some non-examples. And then there's one correct one. So there's one correct and one incorrect. Tell them to stop working, accruing hours until they finish school. Share your own experiences of multitasking, accruing hours, grad school, and working. And these ones are kind of a trick question because it could potentially go either way. If you guys selected the wrong one, no worries. It was a tricky question. No worries. Okay, so which of these is a non-example of empathy? I had put the correct answer, or the incorrect answer was tell them to stop working and accruing hours until they finish school. But the more I think about it, maybe that's part of it. But I think you start with share your own experiences of multitasking, accruing hours, grad school, and working. Tell them how you did it, talk to them, allow them to hear it from another person's point of view. And maybe that's the courage that they need to push forward. Maybe they only have 500 hours left of fieldwork hours, but maybe they have 2,000. Maybe they're just getting started and they are in this feeling of, how will I ever do this? How do I even balance this all? Some of my supervisees have children. They have families that they're trying to care for on top of working a full-time job, finishing grad school, accruing their hours. That's a lot to balance. And by providing that, just telling them to stop working and accruing hours, what if they can't stop working? What if they can't financially support themselves? What if they need to finish school? I don't know if anybody's read the newsletter recently, but coming up in a few years, we're moving towards a 10-year rolling deadline on education requirements. So just something to keep in mind is that maybe they don't have that option. They can't just drop out of school. They can't just stop accruing their fieldwork hours. All right. Okay, compassion. This, I know empathy is a big one, but compassion is a big buzzword in the field of ABA right now. There's a lot of compassionate care, compassionate ABA. But at the root of things, are you being a compassionate supervisor? So compassion is the sympathetic consciousness of others' distress together with a desire to alleviate it. All right. So you walk into think back, anybody who's been in RBT before their BCBA, and this probably resonates with you because it came from a real world experience. You walk into a client session and your RBT says her and the client are having the worst day. He keeps hitting her, spitting on her, and running away. She says she's fed up with the session and she wants to quit. I've heard it. I've been the RBT. I've been on the receiving end of that. And I'm sure many of you have. So what is a way that we could show her compassion in our supervision? Tell her things will get better. Keep pushing through. You're doing great. Offer her a break. Allow her to step out for a little bit. Have her follow through with the demand. She placed it. She completes it. Tell her you're sorry for the client's behavior. Catherine, those are the days where you cry in the car on your way home or to your next session. We've all been there. Yeah, we have. I think everybody would agree that they've had those days. Yeah, Ashley, there are multiple steps to this kind of scenario that would be helpful. This isn't the only one. It's not meant to be your tell all be all. Awesome. So here's the results. 92% of people said, offer her a break, allow her to step out for a little bit. I've been the RBT where my supervisor just sat there, typed on her computer, wrote her session notes, and I sat there with the client pulling my hair, spitting on me, and screaming in my ear. And let me tell you, I was not feeling the compassion in that situation. In fact, I was feeling like I was ready to give up. I was sick of the field. I wasn't getting the support I needed. I was going to quit. I was done. But then on the other hand, I had another supervisor who was fantastic and provided me the compassion. So I stayed. But just as a reminder, be the supervisor that offers them a break. You have time. If they need to take 2 to 3 minutes to step out of session, Let them do that. Maybe they just need to catch their breath. Maybe they've been in that challenging behavior all day. And yes, tell her things will get better and to keep pushing through. For sure. That should be part of it. I completely agree. I think that it's important to use compassion and empathy in this response. It shouldn't just be one or the other. We should be supporting them by allowing them to take a break and supporting them as they come back through, providing them a model. Here's what I would do. Maybe we just need to take a break. Maybe you and the client need a minute away from each other for right now. And telling you're sorry for the client's behavior, I've had hundreds of parents tell me that too. It still doesn't always make it better when you are on the receiving end of things. You're like, I know you're sorry. And maybe this client doesn't mean it, but sometimes just saying you're sorry doesn't always feel the best. All right. Okay, so this is another non-example one. You have a new ABA therapist starting session with a client, and she told you she was nervous and she doesn't fully understand the programs. Which one of these is the non-example? So which one should you not do? Jump in and show her how to do them. Tell her if she would have read the program, she would know how to do them. Tell her you understand how hard it can be starting a new job. Right. Yeah. Don't tell her if she would have read the program, she would know how to do them. She's new. She might not know what a physical prompt is or a vocal prompt or fading or chaining. All of our terminology and lingo that gets thrown around to these new ABA therapists, she might not know what that means. She might need additional support. So jump in, show her how to do it, provide the model. Somebody popped in there and said BST. Yeah, implement a full behavior skills training. That will help her become more familiar with it. All right. Okay. So this is it on our talk on compassion and empathy. However, this is an article that just recently came out by Melton and colleagues, Empathy and Compassion as a Radical Behaviorist Views It, a Conceptual Analysis. Highly recommend. It is a wonderful article that I read with my supervisees. Really breaks down the difference between empathy and compassion. It provides key components to look for when identifying what the difference is between empathy and compassion, and kind of helps you understand better as a supervisor. All right. So active listening. So active listening is not defined in Merriam-Webster. So I went to the American Psychological Association Dictionary of Psychology, which again fits in with everybody who said earlier that they learned what active listening was when they were pursuing their LMSW, their psychology degree. So active listening is defined as a psychotherapeutic technique in which the therapist listens to a client closely, asking questions as needed in order to fully understand the content of the message and the depth of the client's emotion. The therapist typically restates what has been said to ensure accurate understanding. 1 second, guys. I want to make sure. Okay. All right. So the United States Institute of Peace distributed content related to active listening. Like I said, there wasn't a lot regards in the ABA field for research on it. So I went further, and the United States Institute of Peace distributed this content related to active listening, and they identified 4 core principles. And just said that it's important to make sure that the recipient knows that you're interested in them, but also that you're invested in them. Because there are a lot of people who are interested in me, but are they invested in me and my growth? So the first one being physical attention, face the person, focus on the person. Don't type up your supervision note when they're explaining how hard their session was. Take the time to actively listen to them, truly. When they're talking to you and explaining how they had such a difficult session and you're sitting on your computer away from them, why would they want to continue to tell you about their day or express their frustrations or stay with you as a supervisor? Paraphrase, restate portions of their concern or their comments to ensure their understanding. Make sure that you can confirm their feelings towards what they're saying. And then reflect, show understanding for how they feel. And clarify, make sure you understand and repeat the process as necessary. If you need to go back to physical attention or paraphrasing or reflecting, then do that. Take the time to engage with your supervisees so that way they know that you understand their frustrations and that you hear them. Okay. And then within active listening, there are two cues. There's nonverbal cues and verbal cues. The verbal cues are restating portions of what they say, reflecting, asking open-ended questions. And then the nonverbal cues, make eye contact, focus on them, nod when they're talking. The biggest one is allow the other person to finish their statements without interrupting. I still struggle for this. I still will be like, they're talking to me and I'm about to say something and I just sit and I wait because I'm like, I don't want to interrupt you. I have something to say, but then I have to remember maybe that also thinks that they think that I am not fully listening to them. Maybe I have something that's on the tip of my tongue and I feel the need to say it. So when I'm sitting here like this, they don't think I'm listening to them because I'm only thinking about the words that are about to come out of my mouth. So think about those verbal cues and nonverbal cues that you're showing when you are interacting with your supervisees or your colleagues or your supervisor, whoever it may be. Yeah, it is hard to do on Zoom. All right, active listening. So we're gonna have one more poll here. A supervisor reaches out to you because they're having difficulty with a specific case. They tell you it's urgent and they're worried about the client's progress. Which of these is an example of active listening? Call them as you're picking your kids up from daycare. It is urgent, she said. Ask when she's available to hop on a Zoom call to discuss the case. Tell her she's almost done with grad school. She should be able to figure it out and to let you know how it goes. Just have her text you what's going on. Everybody's busy. Everybody has things going on. All right. Yeah. Ask her when she's available to hop on a Zoom call. Maybe you're not right next to each other and you can't have an in-person meeting. But by calling them when you're picking up your kids, you're distracted. We all are. That's when I call my best friends and I wanted to chat because it's okay if we're distracted. Nothing that I'm saying is that important at that time. If I wanted to talk to them and get their full attention, I'd say, hey, do you have a time when you're not going to be distracted? But when you're talking to your supervisee, we should just assume that they need our uninterrupted attention. Ashley in the chat posted a really great thought is to take notes throughout and make sure that we're able to respond to them so you have a good response afterwards as well. All right, your first code word is growth, Growth, growth. Write it down, put it in your computer, take a note, whatever you need to do, make sure you have it down. Yes, code word 1 is here. Code word 2 will be coming. Make sure you write this one down. After I move on, we will not be saying it again. So make sure you have it written down. Your code word 1 is growth. I'm going to give everybody just a few more seconds. All right, last chance. Code word 1 is growth. All right, so this is, if any of my supervisees are here, they will know that this is my favorite tool. I make them read the article. I put the compassionate collaboration tool in an Excel document and they score themselves, and it's my most favorite thing. So Roar and colleagues wrote soft skills, the case for compassionate approaches, or how behavior analysis keeps finding its heart. Again, resources will be shared at the very last slide, and they're in the slides that we share. So I found this article a little while ago, and it's truly been a staple in my supervision for everybody, for when they interact with parents, when they interact with their colleagues, when they interact with their supervisors. And this article primarily focuses on family and client input related to programming and kind of what they're looking for at the onset of ABA services. However, I think a lot of the targets in here, as you'll see, can be generalized to our supervisees. So I'm going to kind of go through the article, and then I'm going to share how I utilize some of the components with my supervisees. Yeah, Michael Hitchcock. I see that. They actually talk about the Bear, Wolf, and Risley article in this one. It's a great article. I highly recommend it. All right, so this is the compassionate collaboration tool. So they are to respond to the following questions using a 3-point rating scale. So you can assess others. I think it's a great thing to self-assess using this after your meeting. So are you incorporating family and individual client input? Are you actively soliciting input from the families about priorities for targets and teaching procedures? Are you discussing the rationale for selected targets? And then are you incorporating the family's input for behavior reduction targets? Do you know what's important to the family? And then are you discussing the rationale and ensuring that it's aligned with the family's input and values? All right, so then the next one, and I'm going to go through these kind of quick. Like I said, these slides will be shared at the end so you can have the resource. Did the clinician use accessible language when interacting with the family, individual, or client? Are you using precise everyday language? And are you avoiding terms that have negative connotations? Using do instead of do not, identifying emotions. And then at the bottom, you'll see there's some active listening. Engage in active or attentive listening, nonverbal and paralanguage skills, nodding, mirroring facial expressions. Are you refraining from interrupting? Are you orienting towards them? Are you maintaining your open body posture? So, like I said, a lot of that's geared towards family and individuals. Here are some of the ways that I will gear towards my supervisees as well. Am I incorporating the technician input regarding goals and procedures? By incorporating them, you're going to get that buy-in for services. They're really going to be involved in what are we doing for this client? You know, why am I teaching him how to tie his shoes? He's 2 years old. That's a really bad example, but allowing them to understand why we're doing things, why we're teaching the programs. They maybe not know about the assessments that we're using to assess the client's skills or why it's important. Maybe the family wants to teach the client a skill, but we haven't told the technician why. Allowing them to also provide their input. Maybe they know the client. A lot of our technicians are with our clients for way more hours than we are as BCBAs. They might have 20 hours with the client and we have 5. And then explaining the rationale, and then sharing the family's values and preferences with the technician. Prepare them for in-home sessions. Let them know what they might be looking for moving forward in their session. And then make sure that your language allows the technician to understand and comprehend the protocol, but also provide them explanations. Allow them to grow within our field. Allow them to know what we're talking about, but to further expand their knowledge. And then again, the active listening and refraining from interrupting. So where do you start? You have this compassionate collaboration tool. It's great. What do? I have compassion, I have empathy, I'm an active listener. What do I do now that I'm this BCBA? Maybe I'm past my first year of being a BCBA. I can start providing supervision without a consulting supervisor. Now what? Or maybe you're a BCBA that's fresh to the field and you're providing supervision to RBTs. Like we had said early in the talk, using behavior skills training. So start with your instruction. Set your expectations for supervision. I want you to focus this first session on rapport. Take time to get to know your client. Engage with them. Here's a couple targets that they know how to do. So maybe you can throw those in as you play, but mostly take time to build rapport. Ask questions. How do you prefer to receive feedback? Do you want me to tell it to you right away? Do you want me to wait till the end of your session? Do you want it written down? Do you want an email? What is the best way for me to give you feedback? How can I help you grow? How can I invest in you? How do you learn best? Do you want to read the program first? Do you want me to model it first? Which works best for you? And then I'll follow up with how you prefer to receive feedback. Encourage questions. Tell them, I'm an open book. If my program doesn't make sense, please let me know, because I wrote it for me to understand, but that might not be how you understand something. Allow them to read through the program and say, this instruction doesn't make sense. Can we talk through it? Maybe it needs to be updated a little bit. Listen to them. We've already talked about active listening. I'm not going to go back into it. But then most importantly, demonstrate humility. When they bring you these questions or concerns with the client, be humble. You don't know everything. I don't know everything. They don't know everything. We're all learning. We're all growing. So take the time to learn with them and to properly explain things. Model. So let's say that's how you're moving forward. Again, this is going to be based on how your supervisee is responding, but in true BST fashion, this is how you'd proceed. Demonstrate the behavior. Like we said earlier, let the tech tap out. Let them take a break. You step in, you do it. Say, hey, you know what? Let me show you. Let's take a break. Let me show you how to do this. Have them provide feedback. With the way I just showed you, does this program make sense? Do I need to change something? Does it all align? And if not, what parts don't make sense? What parts can I update to make sure that it's fluent for all of us that are involved? Accept their feedback. Again, encourage questions and listen. Throughout this entire behavior skills training, you should be encouraging questions and engaging in active listening techniques with them. Role play. Let's say they're still struggling. Maybe you have a client who's super active and always running around, so it's really hard to consistently get time to work on different skills. Take turns being the provider and the client. Maybe you're working through a behavior intervention plan and you need to teach a new skill. Take the time to do that. Again, does this make sense how you would implement this with a client? Is there anything that you would feel would be better if we did it differently? Is there anything that you've tried in session that worked differently? Because maybe they are. As techs, sometimes you're thinking on your feet, which is great. We should have equipped them with the skills to think on their feet. But maybe they are implementing something differently and you don't know about it yet. Maybe they tried yesterday and it worked great, but they didn't think to tell you right away. Or maybe, just maybe, they think they're going to get in trouble for not following the BIP exactly as it's written. Accept their feedback, encourage questions, and listen. Okay, and then feedback. Again, all of these are going to take the skills from our active listening and our empathy and our compassion. Be present. Don't be in another session with another client. Don't say, oh, I'll be right back and run away. Don't be on the phone with your supervisor. Don't be in the middle of a social skills group. Take the time to sit with your supervisee and allow them to explain things and to tell you how things are truly going. Ask them to provide specific feedback. What are areas that I can better support you? Do you need more support with the BIP? Are there certain programs that you're still struggling with? Is there a certain time of day that I should be at session? Make sure that you have that open concept with them that they can truly say, I'm struggling interacting with this parent. Can you come and model these skills for me? And then ask them, what areas do you feel are your strengths? What are areas that you are fantastic at? And then affirm that. I see that. You are great at building rapport with him. You are so good. He loves you. He loves to interact with you and play with you. I can see that you've worked really hard to build up those skills. Remember, our techs also like behavior specific praise, not just our clients. Are there any programs that you need more clarification on? Do you want to sit down and talk about it? Do you want to try role play? Can we go back to any of our behavior skills training and work through that? And again, accept feedback, encourage questions, and listen. So Milton and colleagues in the article, Empathy and Compassion as a Radical Behaviorist Views It, a Conceptual Analysis, they said, as a field, we are practicing in an exciting era. We have embraced the value and need for compassion and care, which is so true. We are moving towards this value-based care with our clients and that we truly want to see them lead these more autonomous lives. But we have to remember that we are working with RBTs and supervising BCABAs or clinicians who are pursuing their BCBA credential. And we as supervisors are responsible for encouraging them to do better and be better as supervisors, as future supervisors. Again, another great article, highly recommend. So then our long-term goals as behavior analysts who are providing supervision, I think it's important that we are creating well-rounded, qualified professionals who have generalized skill sets. While they still need to stay within their scope of competency, they should be able to utilize these skills with their own supervisees, with the clients that they work with. And if they get a client that's not within their scope, by implementing the rest of these skills, or compassion, or empathy, and active listening, they should have the skill to advocate for themselves to need additional support and supervision. They shouldn't be afraid to advocate for themselves. All right, and our code word 2 is feedback. FEEDBACK. Code word 2 is feedback. Yeah, Jenny made a good comment too. Asking them how they prefer feedback demonstrates respect for their role as an RBT. For sure. Being an RBT is hard work. It's tough. Let them know that we do value them and we care for them. Code word 2 is feedback. I'm going to move on because I have another page of resources that I want to share with you guys for those who are providing supervision to those pursuing their BCBAs. All right, last chance. Feedback. Moving on. All right. If you haven't utilized these resources, I highly recommend it. I have primarily used the ABA Supervision Handbook. All of them are fantastic. I know there are links that I can share in the chat for these. Let me pop that in there. This should have most of them to access these resources later on. All right. And then here is the list of references. If you are on the shared slides, these are all on there as well. Something to keep in mind, some of these are not available in PDF form. And if you can't find them, I will post my email at the end. I will post it in here right now, and you can reach out to me for anything.